There is more proof today that the Delta variant of COVID-19 is gaining steam around the world. Sydney, Australia has announced it will soon go back into a rare lockdown for at least a week as officials there try to stamp out an outbreak of the highly infectious variant. Here to talk about it is Dr. Elizabeth Clayborne, adjunct assistant professor of emergency medicine at the University of Maryland School of Medicine. Dr. Clayborne, thanks for being with us. Look, Australia had imposed really strict rules. They had closed their border for a long period of time. They were able to keep their COVID-19 numbers relatively low. What can we learn here in the U.S. from what's happening there in Australia?
Absolutely. Well, I think Australia is a good example of a country that took the COVID-19 virus very seriously from the beginning. And you see that they have subsequent action that's doing the same thing. As the Delta variant is gaining momentum, they're taking that threat in a serious manner and therefore locking down again. I do think it's important to remind people that the caveat is that the Australian population is not vaccinated in the same way that the U.S. is. So their approach is going to be different and should be. But I do think that it is wise of them to be locking down as they have growing concerns and so many unknowns surrounding this new variant.
So to that point, I know that most of the Australian population is not vaccinated and definitely not to the levels that we have here in the United States. But it still seems concerning because Australia was almost the gold standard for so long. We were all looking on social media as Australians were living their lives mask free. And it seems as if they had really, eliminated the virus, at least within its borders. So then considering that, even though we do have the vaccination rates here in the United States, especially in some states hitting that 70% vaccination rate, how concerning then is it that we are still seeing these spreads, these outbreaks that are causing lockdowns in countries that were doing so incredibly well?
Yeah, I think it's twofold. One is that those countries are still trying to catch up to the vaccination rates that we have in the United States, where there's a lot more protection and suppression of these variants erupting and causing a potential wave of outbreak. But the other part is that these countries are trying to stomp out the infection early by having very strict and aggressive reactions to any spread of the virus, so they don't have to go into prolonged nationwide lockdown for months at a time. They are very aggressive when the variant comes up, they're more likely to be successful in squelching that variant from spreading and then being able to return to the life they had been enjoying for a long time seriously up front. It is concerning, though, that we're continuing to see variants that are popping up in countries all over the world. And it's a good reminder that we live in a global community. And so until COVID is controlled on a global level, we will always be at risk for having new variants that can cause eruptions in countries that are well vaccinated, or even especially those who don't have the vaccination rates that we're enjoying in the United States.
I want to talk for a minute about what we're seeing happening in Israel right now, because the coronavirus czar there says he believes, even though they're seeing a rise in new COVID cases, they don't think they're going to be entering a fourth wave, yet they are reinstating wearing masks indoors as that Delta variant spreads. Do you think that so many countries, including many states here in the U.S., now lifting mask mandates indoors is actually going to become a super spreader situation?
I certainly think what people need to pay attention to is the science. So the decisions that health officials make usually is based on what they're seeing as far as where your most risk is when exposed to other people. And indoors and close proximity to other people has always been known as the highest risk situation. So if we are going to renew some of our mask mandates, indoors would be where to start. And I certainly think that as we look at the numbers in the United States and states that are here, if they start to trend up, if our case positivity rate goes up, if our infection rate goes up, if we're seeing a variant that looks like it might be penetrating against the vaccine, then we need to look at renewing and reinserting some of those mask mandates. The countries that are doing that now are probably being proactive because they know from the data that the highest risk situation is indoors with other people. And so that's the easiest thing to target. And outdoors and other things that we now have data that shows relatively safe, they allow people to continue to enjoy that because we want the population to participate and listen to officials and take it seriously when those mandates are passed down.
I do want to ask you, Doctor, about some of that news that we're seeing out of India. India already really struggling under the weight of the virus. First, that Delta variant, but now this mutation, Delta Plus. They've already started really to ring some of those alarm bells that that variant, or rather that mutation of that variant, could potentially be more severe. It could be more transmissible. How concerned, even with the vaccination rates that we have here in the United States, considering that we have so many states that are not up to par with that 70% vaccination rate that the White House had set, that we do see vaccine hesitancy. How concerned should we be about that mutation that could be more severe, could be more transmissible?
I certainly think that the variants such as the Delta Plus that we're seeing now, that looks like it has a spike protein mutation that allows it to adhere to cells and cause a more serious infection, potentially pass more easily, and maybe even be resistant to some of our monoclonal antibody transfusions and treatment options, should scare people. It is actually the primary motivator for those who have not been vaccinated to consider the risks that they're taking. Just because we are seeing a downtrend here in the United States does not mean that a more serious or dangerous virus can pop up here, and if you're not vaccinated, you're not protected. Now, we're continuing to look at the data to see how well our current vaccines protect against these variants, and those all look promising. So both of these things point to the fact that we should be encouraging everyone who's eligible for a vaccine to be seeking that out and getting vaccinated, and certainly looking ahead this year to vaccinating our pediatric population, which will be an important step in further protecting the United States and the rest of the world.
All right, Dr. Elizabeth Clayborne, thanks so much. Always good to see you. Have a good weekend.